Hello, my name is Brieanna Tyler, and this is my presentation on the hepatitis C virus. The hepatitis C virus belongs to the family Flaviviridae, the genus Hep C virus, and the species Hepatitis C virus. The characteristics and biology of this virus. It is a small, enveloped, positive, single-stranded RNA virus. Hepatitis C affects the liver in humans. It causes inflammation, sometimes leading to serious liver damage. And you can see here in this picture, it shows the nucleocapsid RNA center, the core of the virus, surrounded by the core protein. External to that is the viral envelope, and completely external to that is the lipid membrane of the virus. This particular virus does have viral glycoproteins on the surface, also known as the viral spikes. Signs and symptoms of the disease include bleeding and bruising easily, fatigue, jaundice, which is a yellowing of your skin and the whites of your eyes. And yes, when you have jaundice, it actually does turn your skin and your eyes yellow. Produces dark colored urine, swelling in legs, weight loss. Some symptoms do not appear until 20 years after the initial encounter with the virus. So some people can be infected for a very long time and not be aware of it. Certain lifestyles, contribute to risk of contracting this disease. And people with certain risk factors should definitely get themselves checked very often for this disease, because it can sit for a very long time and not be noticed. Some people that do come in contact with the hepatitis C virus are also capable of spontaneously clearing the virus on their own. Their immune system takes care of it, and they don't show any symptoms or signs of disease at any point in the future. Now, how is hepatitis C acquired? Hepatitis C spreads when blood contaminated with the virus enters the bloodstream of an uninfected person, and risk factors that cause transmission include injection and inhalation of illicit drugs, pre-existing HIV diagnosis, receiving a piercing or tattoo with unsterile equipment, blood or organ transplant before the year 1992. A child who's born to a mother with hepatitis C infection is at risk. Unprotected sex is a risk, and believe it or not, razors, toothbrushes, and nail clippers can also transmit hepatitis C. So very careful, normal everyday items right there, the razors, toothbrushes, and nail clippers. Just be very aware that those can transmit HCV, and not to share those items with anyone. Pathogenesis. Hepatitis C is a non-cyclic virus. The pathogenesis is regulated by host immunity and metabolic changes. Both the innate and adaptive immunity play a role in hepatitis C pathogenesis. It's capable of genetic variation, which allows this virus to evade the immune system. Genetic variation capability and the inability to effectively culture hepatitis C complements the development of a vaccine for this virus. There's currently a hepatitis A vaccine and a hepatitis B vaccine. However, there is no hepatitis C vaccine currently. It is being worked on, though, by scientists. They are working to try to develop one. Hepatitis C has been described as a silent epidemic and has killed more people than AIDS in the United States. Now, hepatitis C virus is a progressive disease. It can lead to scarring of the liver, known as cirrhosis. Scarring makes it difficult for the liver to function properly. This virus can lead to liver cancer, which is not very common, but it is possible with infection. Eventually, ultimately, this disease, hepatitis C, leads to liver failure, which is an advanced cirrhosis that may cause the liver to stop functioning. And here at the very bottom, I put 3 pictures. The first one on the left is of a normal, healthy liver. That's what we all want our liver to look like, normal and healthy. In the middle, on the bottom, is a picture of a moderately scarred liver, known as liver fibrosis. Not in a great state there, but the worst one by far is on the far right, on the top right here, which is a picture of an extremely scarred liver with cirrhosis. And that's obviously one that's, been in an advanced stage of the disease. It's not healthy at all. And at that point, probably going to stop functioning. Here are my sources, and thank you for listening to my presentation.